Have you ever experienced that strange tingling sensation in your feet? That uncomfortable numbness that seems to come out of nowhere, making it difficult to walk or even stand? Perhaps you've noticed it getting worse at night, or maybe it's becoming a constant companion, affecting your balance and making everyday activities increasingly challenging. If you're experiencing these symptoms, you're not alone. Millions of people suffer from foot numbness, and many dismiss it as simply a sign of aging or being on their feet too long. But what if I told you that certain foods in your diet, foods you've been told are healthy, might actually be making your condition worse? Most people assume that all vegetables are beneficial for health. After all, we've been told since childhood to eat your vegetables for better health and longevity. The produce section of the grocery store is portrayed as a haven of nutrition, with every colorful vegetable offering protection against disease and supporting overall wellness. But shocking new research has revealed a disturbing truth. Certain vegetables, many of which are commonly recommended as part of a healthy diet, may actually be triggering or worsening foot numbness in susceptible individuals. These seemingly innocent foods contain compounds that can interfere with nerve function, increase inflammation, and exacerbate the symptoms of peripheral neuropathy, particularly in the feet, where symptoms are often first noticed and most severe. The consequences of foot numbness extend far beyond discomfort. Numbness reduces your ability to feel injuries, leading to unnoticed cuts or blisters that can become infected. It impairs balance and coordination, significantly increasing fall risk. For those with diabetes or other conditions affecting circulation, foot numbness can be particularly dangerous, potentially leading to serious complications if not properly addressed. But there's good news. By identifying and eliminating certain problematic vegetables from your diet, you may be able to reduce the severity of foot numbness and improve sensation. Many people report significant improvement in their symptoms within just weeks of making these dietary changes. Today, I'm going to reveal the 3 common vegetables that could be worsening your foot numbness, vegetables that might be on your plate every day without you realizing their impact. Some of these might surprise you, especially since they're often recommended for their nutritional benefits. I'll also share what you should eat instead to support healthy nerve function and potentially reduce numbness in your feet. Before we dive in, take a moment to subscribe to our channel for more evidence-based health tips that can help you live better with greater comfort and mobility. And let me know in the comments, have you noticed certain foods affecting the numbness or tingling in your feet? The first vegetable that could be worsening your foot numbness is white potatoes. These starchy staples are a cornerstone of many diets around the world, appearing on dinner plates as mashed potatoes, French fries, potato salad, and countless other popular dishes. While potatoes do provide some nutrients like vitamin C and potassium, their impact on blood sugar makes them problematic for anyone experiencing foot numbness or neuropathy. The problem begins with the potato's high glycemic index. When consumed, especially without protein or fat to slow digestion, potatoes cause a rapid spike in blood glucose levels. For those with insulin resistance, diabetes, or pre-diabetes, these repeated blood sugar spikes can directly damage the delicate nerves in your extremities, particularly in your feet, which are furthest from your heart and brain. What most people don't realize is that glycemic impact varies dramatically depending on how potatoes are prepared. A boiled potato has a lower glycemic index than a baked potato, while mashed potatoes can cause even more rapid blood sugar spikes due to their already broken down starch structure. French fries and potato chips, which combine the high glycemic potato with inflammatory oils and high heat, create a perfect storm for nerve irritation and damage. But the problems with potatoes extend beyond their glycemic impact. Potatoes belong to the nightshade family of vegetables, Solanaceae, which contain compounds called alkaloids, primarily solanine and chaconine. These natural pesticides help protect the potato plant from insects and disease, but in sensitive individuals, they can trigger an inflammatory response that may exacerbate nerve pain and numbness. What makes this particularly troublesome is that these alkaloids are concentrated in the skin of the potato, which is often consumed for its fiber content and nutrients. The alkaloid content also increases when potatoes are exposed to light or begin to sprout. Those green spots or eyes that develop on potatoes stored for too long are significant red flags for higher alkaloid content. For those already experiencing foot numbness, this inflammatory response can worsen symptoms by increasing swelling around nerve pathways, restricting proper nerve function and blood flow to extremities. This is why many people with peripheral neuropathy or autoimmune conditions report improved symptoms when they eliminate nightshades like potatoes from their diet. So what should you eat instead? For starchy satisfaction, without the nerve-irritating effects, try sweet potatoes, which have a lower glycemic index and don't contain the problematic alkaloids found in white potatoes. Other excellent alternatives include butternut squash, carrots, parsnips, or cauliflower, all of which can be mashed, roasted, or prepared in ways similar to potatoes, but with less impact on blood sugar and inflammation. If you're currently experiencing foot numbness, consider eliminating white potatoes from your diet for at least 30 days to see if you notice an improvement. Many people report reduced tingling and improved sensation within just a few weeks of removing potatoes and other nightshades from their meals. Have you noticed your foot numbness or tingling getting worse after eating potatoes or other nightshade vegetables? Share your experience in the comments below. Now let's move on to the second vegetable that could be contributing to your foot numbness. The second vegetable that may be worsening your foot numbness might surprise you. Tomatoes. Like potatoes, tomatoes are part of the nightshade family, but they're often overlooked as a potential trigger because they're so commonly recommended for their nutritional benefits. Rich in lycopene, vitamins, and antioxidants, tomatoes are celebrated for their potential to reduce inflammation and protect against certain diseases. However, for people experiencing foot numbness, the alkaloids in tomatoes, primarily tomatine and solanine, can have the opposite effect, potentially increasing inflammation in nerve pathways and exacerbating neuropathic symptoms. These compounds are the plant's natural defense mechanisms, but in sensitive individuals, they can trigger an immune response that affects nerve function, particularly in extremities like the feet, where symptoms often appear first. What makes tomatoes particularly problematic is their acidic nature. Tomatoes contain high levels of citric and malic acid, which gives them their distinctive tangy flavor. This acidity can amplify the inflammatory response in sensitive individuals, further irritating already compromised nerves. The combination of alkaloids and acids creates a double challenge for those with foot numbness or peripheral neuropathy. Many people don't realize that tomato consumption can affect their neuropathy symptoms because tomatoes appear in so many foods beyond the obvious pasta sauces and salads. They're hidden in ketchup, barbecue sauce, many soups, stews, and prepared foods. Even small amounts of tomato-based products consumed regularly can maintain a state of chronic low-level inflammation that prevents nerve healing and recovery. The impact of tomatoes can also vary based on ripeness and preparation method. Green, unripe tomatoes contain significantly higher levels of alkaloids than ripe ones. Likewise, cooking tomatoes breaks down some of these compounds, but concentrates others. For instance, tomato paste and sauce are more concentrated forms that may cause stronger reactions in sensitive individuals compared to fresh tomatoes. Another factor to consider is the pesticide exposure in conventionally grown tomatoes. Tomatoes are on the Environmental Working Group's Dirty Dozen list, meaning they typically contain higher pesticide residues than many other produce items. These chemical residues can act as neurotoxins in some individuals, potentially contributing to nerve damage and dysfunction when consumed regularly. If you're experiencing foot numbness, consider eliminating tomatoes and tomato-based products from your diet for at least 30 days to see if your symptoms improve. This means reading labels carefully, as tomatoes appear in many processed foods you might not expect. Instead of tomatoes, try using alternatives like beet puree for color in sauces, carrot puree for sweetness, or pumpkin for thickness and nutrition. For acidic flavor, a splash of apple cider vinegar or lemon juice can often suffice without the nightshade exposure. Bell peppers, though also nightshades, can sometimes be tolerated better than tomatoes for some individuals and can provide similar nutritional benefits. Many people who eliminate tomatoes report noticeable improvements in neuropathic symptoms, including reduced foot numbness and tingling within 2 to 3 weeks. Some even find they can eventually reintroduce small amounts of cooked tomatoes occasionally without symptoms returning, though this varies greatly by individual. Have you noticed a connection between tomato consumption and your foot numbness or other neuropathy symptoms? Share your observations in the comments section below. Now let's explore the third vegetable that could be contributing to your foot discomfort. The third surprising vegetable that may be aggravating your foot numbness is spinach. This might be the most shocking entry on our list, as spinach is widely celebrated as a nutritional powerhouse packed with iron, vitamins, and antioxidants. It's a staple in healthy salads, smoothies, and side dishes, recommended by doctors and nutritionists alike for its numerous health benefits. However, for people experiencing foot numbness or peripheral neuropathy, spinach contains compounds that can potentially worsen symptoms through multiple mechanisms. The primary concern with spinach is its extremely high oxalate content. Oxalates are natural compounds found in many plants, but spinach contains particularly high concentrations, much higher than most other vegetables. Oxalates can be problematic for nerve health because they bind to calcium, potentially creating calcium oxalate crystals that can deposit in tissues throughout the body. These microscopic crystals can accumulate around nerve pathways, creating irritation and inflammation that may exacerbate numbness and tingling sensations. For those already experiencing compromised nerve function, this additional irritation can significantly worsen symptoms. But oxalates aren't the only concern with spinach. This leafy green also contains very high levels of purines, compounds that break down into uric acid in the body. Elevated uric acid can form sharp crystal deposits that damage nerve fibers and trigger inflammation. While purines are typically associated with gout, emerging research suggests they may play a role in other forms of neuropathic pain and numbness as well. What makes spinach particularly deceptive is that its effects can be cumulative and delayed. You might not notice immediate worsening of symptoms after a spinach salad, but regular consumption can lead to a gradual buildup of oxalates and increasing inflammation over time. Many people consuming spinach in their daily green smoothies or as a regular salad base may be unknowingly contributing to their foot numbness. Spinach is also among the vegetables that typically contain higher levels of pesticide residues. The neurotoxic effects of these chemical residues can potentially contribute to nerve dysfunction, particularly in individuals with genetic variations that affect detoxification pathways. This combination of natural compounds and potential chemical residues creates a problematic food for those suffering from foot numbness. Another factor to consider is spinach's high content of vitamin K1. While vitamin K is essential for health, excessive vitamin K1 can interfere with medications like blood thinners that many people with circulation problems take. Proper circulation is crucial for nerve health, particularly in extremities like the feet. So this indirect effect can also impact neuropathy symptoms in some individuals. If you're experiencing foot numbness, consider eliminating spinach from your diet for at least 30 days. Instead, opt for lower oxalate greens like lettuce, arugula, or watercress for your salads. Kale, while still containing oxalates, has significantly lower levels than spinach and may be better tolerated. Cabbage and bok choy are other excellent alternatives that provide many nutrients without the problematic compounds. Many people report noticeable improvements in their neuropathy symptoms, including reduced foot numbness and tingling after eliminating high oxalate foods like spinach from their diet. The response time varies by individual, but some notice changes within just a couple of weeks as oxalate levels in the body begin to decrease. Have you noticed your foot numbness changing after consuming spinach or other high oxalate foods? Share your experience in the comments below, as your insights could help others struggling with similar symptoms. Now that we've identified these 3 problematic vegetables, you might be wondering, what should I be eating instead to help improve my foot numbness? The good news is that many vegetables and other foods can actually support nerve health and potentially reduce neuropathic symptoms when incorporated into your diet. First, focus on vegetables rich in alpha-lipoic acid, a powerful antioxidant that has shown promise in improving nerve function and reducing symptoms of diabetic neuropathy. Brussels sprouts, broccoli, and carrots are excellent sources of alpha-lipoic acid and don't contain the problematic compounds found in the vegetables we've discussed. Second, incorporate foods high in B vitamins, particularly B12, B6, and folate, which are essential for nerve health and function. Asparagus, beets, and dark leafy greens like collards, which contain significantly fewer oxalates than spinach, can help support your nervous system and potentially improve symptoms over time. Vegetables high in magnesium can also be beneficial, as magnesium plays a crucial role in nerve transmission and muscle function. Avocados, which are technically a fruit but often used as a vegetable, are rich in magnesium and healthy fats that support nerve cell membranes. Other good options include peas, broccoli, and cabbage. Anti-inflammatory vegetables should be a cornerstone of your diet when dealing with foot numbness. Celery, cucumber, and leafy greens like lettuce contain compounds that help reduce inflammation without the problematic characteristics of nightshades or high oxalate vegetables. Onions and garlic are particularly valuable for their sulfur compounds, which support detoxification and circulation. Beets deserve special mention for their unique ability to improve circulation. They contain natural nitrates that the body converts to nitric oxide, which helps dilate blood vessels and increase blood flow to extremities. Improved circulation is essential for delivering nutrients to damaged nerves and removing inflammatory waste products. Beyond vegetables, consider incorporating omega-3 rich foods like wild-caught salmon, walnuts, and flax seeds, which help reduce inflammation throughout the body. Turmeric with black pepper is another powerful addition, as curcumin, the active compound in turmeric, has been shown to support nerve health and reduce neuropathic pain in some studies. Stay well hydrated, as proper hydration is essential for nerve function and toxin removal. Sometimes, simply drinking more water can help reduce the severity of neuropathy symptoms, particularly if mild dehydration has been constricting blood vessels and limiting circulation to extremities. Remember that dietary changes take time to show their full effect. While some people notice improvements within days of eliminating problematic foods, others may need several weeks or months of consistent dietary changes to experience significant relief. Be patient with the process and pay attention to subtle changes in your symptoms. It's also important to note that while diet can play a significant role in managing foot numbness, it's just one piece of the puzzle. Regular gentle movement, proper footwear, blood sugar management, and addressing nutritional deficiencies through targeted supplementation may all be necessary components of a comprehensive approach to improving neuropathy symptoms. If you're currently experiencing foot numbness, consider keeping a food journal to track how different foods affect your symptoms. This can help you identify personal triggers beyond the common ones we've discussed today. Everyone's body responds differently, and your specific combination of genetic factors, gut health, and overall inflammation levels will influence how certain foods affect your nerve function. Have you found any foods that seem to improve your foot numbness or neuropathy symptoms? Share your discoveries in the comments below. Your experience could be incredibly valuable to others on a similar journey. I also want to address an important point. If you're experiencing new or worsening foot numbness, don't assume it's just due to your diet. While the vegetables we've discussed can exacerbate symptoms, foot numbness can also signal serious medical conditions that require proper diagnosis and treatment. Conditions like diabetes, vitamin B12 deficiency, autoimmune disorders, or even problems with the spine can cause similar symptoms. If you haven't already done so, schedule an appointment with your healthcare provider for a thorough evaluation. A proper diagnosis is essential for developing the most effective approach to reducing your symptoms and preventing further nerve damage. This is particularly important if your numbness is accompanied by pain, weakness, balance problems, or has been worsening over time. It's important to remember that foot numbness isn't something you have to simply endure or accept as inevitable. Many people have significantly improved their symptoms through thoughtful dietary changes and other natural approaches. By eliminating problematic foods and incorporating supportive nutrients, you can create an environment that promotes nerve healing and potentially restore normal sensation to your feet. If you found this information valuable, please like this video and subscribe to our channel for more evidence-based health tips designed to help you feel better naturally. And if you know someone who's been struggling with foot numbness or tingling, please share this video with them. The information you share today could help someone take the first step toward relief from these uncomfortable and potentially dangerous symptoms. Thank you for watching, and I'll see you in our next video. Here's to healthier feet and better quality of life.